Thank you for that. Hello everyone. My name is Beatrice Lukashevich and I am the Children Missing Education Manager in Manchester City Council. So today I will talk about some of our practices, including the usage of HMRC checks, and hopefully share some useful information with everyone. So just to give you a bit of an insight as to how CME works within Manchester City Council, we are embedded within the wider school admission service with transition and in-year teams. So we operate on a district level with named officers supporting a set of designated schools. Working this way has proved to be efficient for ourselves. It enables proactive tracking and sharing information across teams. There is more consistency in support and those reduced timescales for children out of education. So the CME team structure, each officer is also responsible for a cohort of schools with particular area, building that rapport with schools and being a point of contact for any issues or further support when it comes to off-rolling children and assisting with any CME related queries. Just to share another useful, valuable tool for ourselves is efficient tracking information sharing, which comes by the use of single shared database for admissions, social services, early help, EHE, and attendance teams. So this centralized system ensures that all teams can access up-to-date real-time information, and that ability to contact anyone else involved in the child's welfare and education, access that information this way supports that strong multi-agency collaboration and enabling timely interventions for children missing education. And just to mention as well, a robust reporting structure is in place with monthly data used for early identification and prevention of CME. There are several reports the CME team run on a regular basis to identify new arrivals into the city, fast track them into education, or complete checks to certain if they're not in Manchester, identifying children who are not on a school roll or have been recently enrolled from schools and cross-referencing that with our system to ensure that the school has indeed sent us an off-rolling notification form. And there's a clear escalation route for officers within Children Missing Education team. So I'll just move on talking a little bit about HMRC data sharing and how that has been a very valuable tool for ourselves. So with HMRC data sharing frequency and volume, the data received by us help us locate children who have been missing from education for a period of at least 3 weeks and who may be at risk of harm. So Manchester CME will share the data with HMRC weekly at the maximum and will make up to 50 referrals per week. HMRC will share any relevant address details when a new address is established, and the response is usually received within 1 to 2 weeks. However, there are certain requirements when sending out those referrals. So HMRC requires us to provide a few different things, so including a unique reference number for the inquiry, name, date of birth for the children missing from education, the date of child last attended school or was due to start school if they failed to attend, date and outcome of a home visit to address last known, full name of parents, any linked siblings who are also missing education. And what will happen following that? HMRC will respond to our referrals and they will provide full address, including postcode, if a new address has been established. That could be in another local authority as well, in which case we will contact that local authority to ensure that they're aware of the family there. There could be a situation where a notification that HMRC is unable to trace the family, and there could be also no trace on HMRC systems. So we have found using HMRC and working with them together mutually beneficial, whilst the data received to HMRC assists to identify potential fraudulent tax credit and child benefit claims. HMRC considers that the disclosure of information too is necessary and proportionate because it's required to enable local authorities to identify those whereabouts of children who are missing. And just to give you some numbers as well, there's been 116 cases referred to HMRC from Manchester in this academic year up to June. And with 71 out of those cases, we received additional information that assisted us with finding the whereabouts of the children. So I'm just going to be moving now just to speak a little bit about other checks that might be useful for other local authorities. So we work closely with a range of internal departments like homelessness, social services, early help. These teams provide that vital intelligence that help us trace children who have disengaged from education or moved without notifying schools. But obviously that collaboration extends beyond Manchester. We will liaise with other local authorities across the country to share that information, coordinate support for families who have moved between areas, and ensure that continuity and safeguarding. Um, and the other checks that probably you have heard either through the previous webinars or by using your own checks is Border Force. We have found this very useful in situations where suspected international travel or safeguarding concerns. Council tax checks, very essential, helping us to verify the current addresses and identifying families who may have moved without informing schools, aiding in locating those children who are no longer attending. Health services, including health professionals who maintain that regular contact with families, even if children are not in school. Health will inform us of any new arrivals into the city or children who they have seen who are not enrolled in the school. Um, Another one to mention is social media checks. Where appropriate and lawful, of course, social media activity can provide clues about families' location and movements, supporting those efforts to trace children who are missing from education. And last but not least, home visits and contact with parents. That direct engagement through home visits allows us to verify residency, assess the child's situation, and encourage re-engagement with education. That regular contact with parents is key to understanding any barriers and offering that further support. Um, and just to give you a little bit of an insight about Manchester as well, I think it's important to mention some key trends that we see over here. So we've been seeing a big increase in referrals year on year. We're a very busy city with a lot of movement of children and families in and out, which can at times possess a challenge as well. So September 2024 to present, there's been already a 22% increase from last year in the number of referrals in and off-rolling forms which we receive from schools, with movement out and at times children returning back to Manchester. We've identified about 97% of pupils whose whereabouts we weren't aware of initially. We found that majority of those missing, and the remaining 3% are cases that involve pupils who were either referred with inaccurate information or incomplete information, or who have never resided in Manchester, just highlighting that importance of accurate data sharing across regions. And just to mention some challenges, so there's obviously, with Manchester being a very busy city, there's a high demand for school places, particularly in certain year groups and geographic areas, which continues to pose a challenge in ensuring timely placements. Transient and mobile populations, frequent relocations among families, especially those in temporary accommodation and housing, experiencing housing instability, complicate those efforts to maintain consistent educational engagement and tracking. Of course, important to mention that some families will exhibit low engagement with education services that will require that additional outreach and support, and particularly challenges are faced in supporting and tracking certain groups, just to mention, of course, refugee and asylum seeking children who may face those language barriers, trauma, and uncertainty about their legal status, and Gypsy, Roma, and traveller pupils who have often unique cultural and mobility related needs and require also tailored approaches. So that's the end of my presentation. So I'm happy to answer any questions in the QA section. Thank you.
Thank you so much, Beatrice. That was really helpful, and I can already see lots of questions coming in. So we'll make sure that we will read those to you during the Q&A section. Thank you. Okay, so I will now head over to Anne and team, who will discuss data linking and share a really useful tool with you all. So,
okay.
Hello.
Hi, I'm Anne Clark. I'm the Inclusion Manager at Oldham Council, and we're slightly different to Manchester. Inclusion is made up of fair access, school attendance, exclusions, children missing from education, and electively home education. And prior to our move to new offices, we all sat within the MASH team also, but now we sit back with education and SEND. I'm joined today by Michelle. Michelle, do you want to introduce yourself? I think I'm joined by Michelle. No.
Hello, sorry. Hi, I'm Michelle. I'm the Children Missing Education Officer at Oldham Council.
And also John.
Hello, my name's John Sikora. I'm the Senior Intelligence and Data Analyst for the Education at Oldham.
Fabulous. So our CME team, when we say team, is made up of Michelle and a part-time support officer, which, like I said, sits within the world of inclusion. We also have 4 attendance officers, 2 senior officers who cover fair access and home education, but all the attendance officers support Michelle and the support officer in CME also. As we all know, that our CME tend to be the most children who are at risk and our most vulnerable young people, or can be, who can be at risk of harm through exploitation, radicalisation, and often become NEET. So today we've been asked to demonstrate our Power BI system. This is a system which connects our education and social care systems. So we use Mosaic and Synergy in Oldham. Prior to our Power BI, all our data had to be manually extracted and cross-matched, which often led to a few errors, especially when Ofsted were due and we were cross-matching which young people who were CME were open to children's social care, and often this information wasn't quite correct. Now this process is completed daily, it's automated, and therefore we feel we can't be fully confident, but we're a lot more confident when we do get the ILAC call like we did last year. We feel that this system supports us in having all our information in at one point of contact, and we don't have to rely on the tedious task of various people trying to cross-match our data. Next slide, please. John, would you please take over here and explain how you designed our system and what you can do with it, please?
Of course, yes. So this we got our Power BI system installed. It's about 12 months ago now, and like Anne said, we have to connect the 2 databases. So we've got the social care side and the education data, and Power BI allows us to connect it. And what this does is, on a daily basis, it just connects the 2 databases so that we can see at a glance any new children that have appeared on the CME database, and also any filters that you want to check. Again, this is a back and forth with the department so that we can search on anything, the ID of the child or surname, and any other things. So yes, this is a daily download, and so it's not perfectly in date, but I'll be speaking to Manchester later, I'm sure.
So what happens in here? So if somebody from social care comes to us and says, how many children we've currently got who are not on the roll of a school, who are CME, who you're looking for, who are open to children's social care, we're able to give that information straight away. In the past, Michelle relied on children's social care to speak to her, inform her that there was children who were missing, who'd moved into the borough, etc., who were on CP plans or child in need plans. However, now since the system's been introduced, we're not relying on that information to be shared verbally or via email. It's there, it's being fed in on a daily basis, so we can support in our most vulnerable groups in getting them into a school, or indeed tracking them elsewhere, because we know that they become a child missing from education. So, Michelle, do you want to add anything into that?
Hi, yeah. I think for myself and my colleague, with the tracking of children, what it allows us to do, it reduces the time spent on spreadsheets and extracting data from that, everything manually. It sort of eliminates that. It also allows us to identify any of the vulnerable children that Anne's just mentioned, that are open to children's social care. It would allow me to go on, I can go on and check this daily, and cross-match that way of children, and action those ones that are vulnerable and within that cohort. And it
also
improves,
the
sorry,
SEND
Anne.
children, sorry, I'm
Yeah,
just butting,
yeah,
our SEND cohort as well. We're
yeah,
able to give our SEND colleagues a nudge and say, look, we've got a child here who's got an education healthcare plan. They've
yeah,
been open for, this period of time. Are you aware of this young person?
yeah,
So, it's not just children's social care, but it's also other
yeah,
colleagues within
yeah.
education. Sorry, Michelle.
It's okay. And it improves the efficiency as well in terms of administrative work for myself and my colleague. It allows us to concentrate on the ones, children that are most vulnerable, like EHC plans, child in need, early help. We can extract that data direct from Power BI. We still use spreadsheets, obviously, and everything like that, but this allows us to look more closely at children, for early identification, and getting them tracking back into school as soon as possible.
Okay, can we have the next slide, please? John, do you want to just mention how we can use this with the trackers that you've also embedded into this system?
Yeah, one of the good things about Power BI is that it connects to our Microsoft 365 system. So you can set alerts and filters for any measures that you want to, and this will just send out an email to say that you've had another 3 CME this morning, and anything else that you want to measure.
Yeah, and this supports us in when we feed back to senior leadership meetings, DMT, etc. So we're able to say, at certain times of year we have certain spikes in our CME numbers. So we're able to, present the data visually, which is what they quite like seeing. And also we're able to identify certain areas within Oldham where we have higher numbers of CME, and also the filter out the reasons why they may be CME as well. Again, all it helps us to provide the data for our senior leadership, and we all know our senior leadership love the data regarding CME and EHE, etc. And I know it's only about CME, but we also use Power BI for exclusions and EHE and SEND as well. Okay, next slide, please. So the benefits. Well, Michelle's already mentioned one, the fact that it supports her in a timely manner. But really, for us, it's key knowing our young people who are open to children's social care. Even though I do feel that Oldham have a really good relationship with social care. However, just being able to know our numbers at the touch of a button is absolutely fantastic, and we can zoom in on that cohort rather than just having a huge number of of CME children, but not knowing our most vulnerable cohort. And this allows Michelle and her colleague to identify these and work in a timely manner to try and get them into educational settings, or indeed track them across other local authorities. So it is making our team more efficient. And as I said, Michelle's team, Michelle and her one other little person, we need to be more efficient, and this has supported us in that. And like she mentioned, it removes the use of spreadsheets, reduce the risk of human error, and like we said, the information is readily available. It's all in one area, and we can dip in and out of it, and so can colleagues also. And like we said, we can share information in a timely manner with people when they want it, and hopefully always be ready for when we get the call from Ofsted. I think that's it from us all. Thank you for your time.
Thank you so much, Anne, John and Michelle. That's really, really helpful. Okay, so it's time for our final presentation today, and I'd like to welcome Tracy, who will cover CME stakeholders and training for schools. So over to you, Tracy.
Hello, I'm Tracy Jones, Group Manager for Education Access in the London Borough of Newham. Just a bit of context, Newham is one of the 32 London boroughs, and Newham is situated in the east. The borough has ongoing high levels of poverty and temporary accommodation, which leads to issues with children missing education. Newham is considered one of the most diverse boroughs, and that leads to many other issues in relation to children missing education. We've got 21 secondary schools and 70 primary schools, which may not seem a lot to people on these calls. However, in the London Borough, we have got some of the highest levels of children, even though we're one of the smallest geographical. So in 2022, we had quite a significant restructure within the education service. And that led to myself taking into my portfolio children missing education, penalty notices, attendance prosecutions, and child licenses. It really helped because I was also the head of admissions at the time. So it was good to bring the areas together. And this restructure was really the launch pad for us to do the real-time transformation that we wanted to do across the borough of children missing education, school attendance orders, leavers and non-starters, which we feel are the linchpin to everything that happens under the children missing education umbrella. So now I'm going to start with our journey. So the journey was baselining. What was really understood locally? We didn't want it to just be something that happened in one small area of the local authority. So we asked the question, who do we think are responsible for children missing education? And we asked this across the spectrum of people within the council, and we asked within our schools, from school leaders all the way down to people in the school offices, everybody. And the vast majority said council CME officers. They had no idea that CME was part of their remit, hence why the transformation was deemed really, really important. So education is an integral element of safeguarding, as everyone on this call is aware. So we made it clear that everybody is responsible for children missing education. And that was our launch to where we were, because it meant everybody across CYPS and other services, including our family of schools, wanted to be involved in the process. If we can go to the next slide. So where did our transformation journey start? We wanted to implement a new compliant approach. So as I said, the restructure helped us do that. And we wanted to move away from the traditional spreadsheets people were using to our integrated single system for the single view of a child. And that has different modules. And one of the key modules that we were using was in relation to children missing education and prosecutions. So what we did was we agreed a scope for children missing education. We created a project plan for go live, and then business as usual. We didn't just want it to be one of the projects that we all know has a cliff edge and then is forgotten. We've all been there. We've all got the T-shirt. We wanted it to be real. We've built and robustly tested new process flows and online smart forms, because our online smart forms have really changed the way we work with children missing education and the school attendance orders and everything linked to it. And it was really made us much more compliant. And then we went into identifying key stakeholders in our wider groups. We introduced a director-led strategic board, and I will emphasise this. Our Director of Education, Annabelle Bates, is really behind this. She's not just someone who is there to receive the data. She is front and centre of this programme, and she chairs all of our strategic board and is involved almost on a daily basis with all elements of this. Then we developed and launched a clear communication strategy, thinking about who was the audience and making sure the communications was appropriate for each one of those audience members. Then the key part of what we're talking about today is we provided a local training officer for all stakeholders, including schools, because we felt sometimes schools were out on the periphery and weren't necessarily involved directly in children missing education. Then we designed and implemented a reasonable inquiries tracker, again for continuity of approach, and we implemented a monitoring program for quality assurance. We can move on, please. So these were the pillars of our children missing education. The key part was identification of all school-age children in the borough. It's not that easy to know who all your children are, and our strong partnership with health and their data sets really helped us do that. We wanted a simple admissions process. As I said, Newham is very diverse. We have some of the highest numbers of different languages spoken. So we wanted a process that handheld people through that, so there was no barrier to accessing education, so children weren't missing education just because they couldn't apply. Then we wanted timely start dates, because we are aware that just because a child is offered a school place doesn't mean they start as quickly as they should, and there could be multiple reasons as to why that happens. We've got a good attendance management and a really useful toolkit that we introduced for everyone. Then located a child's whereabouts. That is one of the key things that everyone thinks about with children missing education. And one of the things that was really important to me was the compliant and accurate leave reasons, because we felt there is a real challenge where schools are allowed to delete people from their register when there is a possibility that they actually may be children missing education. Because of the way the legislation is, there can be slight confusion, hence again why the training was important. And obviously at the centre of it all is ongoing stakeholder engagement. I must stress, we wanted to make sure this wasn't a one-off, you come today, then we forget you. We wanted to embrace this, and we've been working on this for the last 2 years to make sure everybody's very involved. And obviously linked to this is accessing internal and external databases, our local authority monitoring enforcement processes, training that's supported with clear accessible resources. We've got online resources that our schools can access at any time. Obviously they can access people, but because like everywhere human resources low, we wanted to have other resources. And then our management information system gives us a daily access to information. Thank you. We can move on. Then this was our strategic board. So a key part of this is our cabinet member for children services and education, and she is also the deputy mayor, and she takes a keen interest in this. Again, this isn't a when she needs to, this is a regular keen interest with open dialogue ongoing. The chair is the director of education, and she does chair every meeting. It's not just a chair that happens. Then you can see from the diagram all the other people that are involved. So our children missing education, as we've heard from other colleagues, is really broad. It doesn't just centre around the children missing education team or people who appear to have children missing education in their role. It's everybody. We want to make sure there are no barriers to children accessing education, that we don't have any gaps for children to fall through. And when children can't be located, we have robust processes across all of our services where we can locate them and track them as quickly and efficiently as possible. We can go on to the next slide, please. So I'm not going to go through this in detail, and apologies, the slide's quite small, but also our cohorts of children that we recognise as children missing education, because we don't just look at those who are traditionally missing education. We look at the broad umbrella of children who are not in full-time education. So we look at children who should be starting reception but choose to have deferred entry, because we know those children, we would hope they'll be in school, but if they're not, we track them to make sure when they are compulsory school age, we have triggers in the system to track admissions to look that they've actually applied. Then we have children who have got a school place but don't start. So to make sure there's swift action in relation to school attendance orders where relationships are broken down before they've started, and all the other factors that we need to do, including in the very, very rare cases where a direction may be required. We leave no stone unturned in making sure that children are in school. Then we have the children where there's no school application. Those we reach out to, we work with our schools, we reach out, we work with different family support groups that we've got within early help to make sure families access education and can do that and support them in filling out what can sometimes be seen as a complex admissions form. Then children for education outside of Newham, that is one of our biggest challenges, where people, as part of our pan-London admissions process, each London borough does their own part of the pan-London transition processes. And sometimes when children get places outside of the borough, accessing those start dates can be difficult. So children may be children missing education, but they might not. But we just don't know because we haven't got the data sharing, especially in relation to academies and further reaching activities that we'd need to have. Then if I go swiftly on to those children on part-time timetables, because they're important to us as well. We want everyone in full-time education. Children with attendance concerns, and we're talking where there is really entrenched attendance behaviours, and the integrity of the leaver form where children are deleted from the admissions register. We want to check it was really the right thing to do. An alternative process shouldn't have been followed. If I can have the next slide. So the training. There was director and member commitment and support throughout this. They senior leaders were guest speakers at all the events we did. They wanted to show that they was involved in this as much as everybody else, and head teachers were really committed. We showed how we did accurate identification of all the stakeholders to make sure nobody was left out. No one who should have the training didn't have the training. We did a really robust awareness campaign, being your role and your responsibility in relation to CME. We worked hard with schools to get school leader buy-in. This was something that was new, so something we had to really talk about, and schools really got it and really bought in, but obviously they'd never had the dialogue before. We had committed delegates. They didn't turn up and tried to slip away at lunchtime. They stayed the whole time. One of the important things that I had was the amnesty to promote and support open dialogue. We had to say that at the start of the meeting because we knew it was in a transformation phase, and we felt some people were nervous to say what was going on in their school or their area, and they had full support of school leaders in saying, this is our beginning, this is our start, we have an amnesty. And therefore we went into back to basics. This is it. We don't know what you know, so we're going to assume no one knows anything. And we trained everyone up to get ensuring that everyone was compliant and following the same process, clear training materials, and keeping focused. We wanted to make sure that there wasn't any creep in what the scope was, because we did find once people had access to us in training sessions, they wanted a lot of questions, and sometimes you can go off scope. And like me, I can talk a lot about anything, so we moved sideways. I made sure we didn't do that. And then maintain the drive for compliance. It's about maintaining everything all the time. We've got network groups, face-to-face forums, refresher training, everything to keep people on board. Then, sorry, the final slide. I think it's the final slide. I'm sure it is.
I had that one as my as the final slide, Tracy.
Oh, sorry, there was just one final slide in really saying that what we did, we brought everyone in to be a family of people looking after our children in Newham to make sure they didn't fall through the gaps. And that was like the start of our journey in bringing everyone in. And then the next part and the next chapter in our journey is really a deep dive into leaver notifications, because that is where we feel the next significant challenges. Apologies if I went over, and apologies, there was one final summary slide that wasn't there. Apologies.
Thank you so much, Tracy. Thank you. And thank you to all of our presenters today. And yeah, to everyone already putting questions in the chat. But yeah, we would like to, I'll hand over to Maddie now, who will chair us through our Q&A. But yeah, please do use the raise hand function. Come in if you would like to ask a question to us or to other LAs or to any of the LAs who presented on any of the topics today. I'll stop sharing the slides now as well.
Yeah, thanks, Faye, and thank you to all of our brilliant presenters today. That was really interesting, and you can tell from how active the chat has been just how of value that has been for everybody who's joined today. I will go back through some of the questions that have been posted in the chat just for everybody's benefit, as I know that moves quickly. And we will collate all of those afterwards, as some people have asked, and circulate following the event today. But first, I'd love to invite anybody who has any questions to come off mute and put those to our presenters. Okay, maybe I'll go to some of the questions in the chat, and then hopefully that'll spark some more questions from everybody today. We can get a bit more of a discussion going. I can already see, Beatrice, that you've been answering lots of questions in the chat, and I can see that you've shared the name of the database that you use and some of your digital media policy there as well. You talked about some of the other services, agencies, organisations that you've set up information sharing arrangements with. Somebody specifically asked how you've arranged checks with any sort of health services in your area. It'd be great to hear how that's been for you and if there's any learning for anybody else on that.
Hi, yes, so I think the health services, we have been working with them for a long time, so they were arranged before my time. So I will ask if Jane is around in the call, if she has any learning to share from that when they were arranged before my time.
Oh, hi, it's Jane. No, yeah, we have been liaising with health for many, many years. It starts with the reception children, so, you know, identifying our cohorts. One of the checks we do with health is they send us details, we send them details, and we all meet in the middle. It's useful. We now just recently on an electronic like spreadsheet form, so the information is consistent, name, date of birth, instead of just partial names, any addresses. So yeah, we liaise with them a lot, and for many years, and they're useful for identifying cohorts and children missing education. We have like people from public health and hospital school who have access to NHS databases, and they can suggest lots of different ways and routes. So it's, if you're ever not sure, just always reach out to those people with your queries, and I'm sure they'll be able to help.
Thanks, Jane. That's really helpful there. Pragna, you have your hand up.
Yeah. Hi, Jane. I'm from Harrow, CME officer. Sorry, is there a particular person you go to in health that could link to all these different teams within health, or do you go to the different teams in health?
We have email addresses which are centered across the city. So we'll have a north, south, and central health email addresses which we use. But I'm sure if your borough liaises with health, which I'm sure they will, because they do multi-agency working for a lot of things, like especially like aids and adaptations and SEN, so education, health and care plans. You'll be able to get your contacts through going down those routes, maybe. You know,
Okay,
if you
thank
use your admission staff to see who they liaise with, you can always connect with the same people and ask those questions.
Right, thank you.
Thanks both, really great discussion there. Samantha, I'll bring you in.
Hi Jane, so I'm Sam from Sheffield. I think my question's around the data. So the data that's input in relation to children from health that are rising fives, is there somebody in your local authority that looks at cleaning that data? Because
There is,
what we're
yeah.
finding is we've got a lot of ghost children that either
Yeah.
the date of births are not correct, and
Yeah.
we're just trying to we're looking at how we can do that next in relation to
Yeah.
next steps. But is it a barrier? Does it present as a high number of children?
It is a high number of children, and we know our cohort is around 67,000 for reception children. Sometimes it can be around 13,000 lines of data that come through for that date of birth range. We have performance and research information team who sort of like own our data. So there's regulations and guidelines there. So what they do is they start with that data and they start sifting through it to make that, well, they don't make that judgment, but they start separating it out. Obviously, there's a lot of data, historical old data in our system. So they filter a lot of that out, and then they'll come to the service, to the business, to make the decision on data that they're not quite sure about. And then we're left with a cohort of around about 7,000 or 8,000. From that cohort, we're right out to them, try and contact them. We do get a lot of return to senders because they've now moved on. We deal with those as and when those queries come back. And we generally find we do always capture the children that we need. We work with early years, we work with the nurseries, we work with quite a lot of people to firm up that cohort of children.
Thank you. Do you have any additional resources to be able to do that? I don't know how many people you have in your area.
In area for what, CME or?
Yeah.
CME, as Newham said before, it's everyone's responsibility. So we do have a designated CME team. They deal with our actual whereabouts unknown and off-rolling, on-rolling. We then have children missing education, but we class them as known. That's done by the admissions in years teams. So yeah, we share it across, and I think Manchester, I've got around about 54 members of staff now. We also do door knocking, and that starts right at transition. So transition team for reception will start door knocking for their applications to try and find the children. So they'll carry out a round of checks before that record is eventually passed to the CME team for whereabouts unknown. Does that help?
It does, thank you. Yeah.
Okay.
Thank you, Jane. Pragna, I'll bring you back in again.
Social media checks. Can I just ask, because it's very difficult if you go on, say, Facebook or Instagram or even LinkedIn, when you're doing checks with your own identity, because they can find you on the searches. So how do you actually do the social media checks without giving away your identity?
We have a Manchester City Council login for that. We don't do it as using our own personal details.
Great, thanks, Jane.
Thank you.
Perfect. That's really helpful and some great questions there as well. Matthew, I can see that you've put a question in the chat saying, please can we have some clarity on the closure of CME cases? Can our involvement be closed when the receiving local authority acknowledges the referral, or do they need to be enrolled at a school before we can close the case? So in cases of children missing education where they've been added to your CME list because you suspect they've moved into another local authority area, but you're unable to confirm that they are in receipt of suitable education, Once you have identified the local authority that they have moved into, and that local authority has confirmed that the child is in their area, it then becomes that local authority's responsibility to confirm that the child is in suitable education. So it is at that point that the previous local authority will be able to remove from the CME list. So just to clarify, it's the local authority that the child is residing in that has the responsibility for carrying out the CME duties, but only once you have confirmation that the child is in that area. I hope that helps on that one. Shaquille.
Yeah, thank you. Just a question for Tracy. You mentioned that you've developed some online smart forms. Can you elaborate on what they are and what they actually do?
Sorry, was on mute. Right, what the smart forms are is in Newham, it's our corporate platform. So we use Granicus forms. That isn't saying it's the best, it just happens to be the corporate platform we have for all online forms. And the online forms, what we do is we have an introduction about what the form is about, what the purpose of the form is, so why you would use this form over another form. We also have forms that explain to people which form to use where things are quite complicated, nuanced processes. And those forms really handhold the person completing the forms, and we've got them for everything in my area. So we have pop-up messages if they're not sure what to write in. There's a lot of drop downs. So that way we control what comes in. So we actually get it as data coming in, as opposed to lots of narrative and lots of people detailing the same information but in a different way. So the forms are smart in a way that they support the user, they support us in the data sets we have, and they also support ensuring that it's the correct data and the correct form.
And what sort of forms do you have? Do you have it for new notifications? Do you have them for schools deregistration and joint inquiry forms, or what sort of forms do you have?
So we've got it for the public, so admissions, for requests for appeals. We've got it for CME referrals. The CME referrals come in different forms depending on where they're coming from. Some are on the Newham website, but most are actually in our portal for schools and other local authorities. We've got a school attendance order referral form. We have a leaver notification form, because we match that across with the data that we get in. So we get in daily data of leavers. We match the actual leaver notifications against the notification forms we get in that provides the narrative about why the child has left, hence why our next journey is going to be that, because it's quite startlingly different information. And we have it for any prosecutions, anything that a school needs to notify us they want to do, a member of the public or another part of the council. There's a form for them to fill in, but the priority is for us to get all the information we need at the start rather than go backwards and forwards. So it's much time saving efficiencies in doing that. But the most important thing is it comes in a data format as opposed to free text. I'm happy to talk about it more if you want to call me, because I know I talk too much. So.
Oh, brilliant. Thank you, Tracy.
Thanks, Tracy. All of value, though. And there's another question there in the chat for you as well, asking, do you deliver your role and your responsibility across your LAs and schools? And what does the training look like? Is it recorded, face-to-face, or bespoke on request?
So when they say you, I assume it means me, but I personally do it. I'm in a room. So we have a room, no more than 100 people. I did joke and say at one point it was like selling Oasis tickets. We had people arguing, why did they not get on the first session? And therefore it's a face-to-face session. We ensure it's face-to-face because I just feel you have much more commitment talking to the screens when you don't know people are there, whether people are actually engaged with something. And that's why school leaders were really committed to saying to people, no, go out, be there, be part of the audience. So it's face-to-face. I deliver it myself, PowerPoint. We share the PowerPoint later, but it can't be shared more widely by the users. And then we follow it up, as I said, with forums, so that it gives people time to go away, reflect on what was said, and then we, as I said, have a constant follow-up.
Brilliant. Thank you, Tracy. Really helpful there. We are almost coming up for time, so I'm just going to put one more question to Anne on what they've shared today from Oldham. We had a question in the chat, Anne, which was asking about the Power BI system that you use and asking if this is mainly used for data reporting and identifying various cohorts of children missing education, or if you're able to use it to actively track children and open cases.
No, it's literally reporting on, but it helps us identify which cohort they are in, so that if they're open to children's social care, because we weren't necessarily being told previously that they were open. So it's for us to be able to track our cohort and then act appropriately when we know what section they're in.
Brilliant. Thank you, Anne. Pragna.
Sorry, Maddie, I'm going back to the questions, what you said about CME and whose responsibility it is if they move from your local authority to a new area, or you don't know where they are, but you believe they've moved to that new area, then I assume because you're a residing, it could be a school that's in a neighbouring borough, but they could live in your area. So they could reside in Harrow, but go to a school in Barnet. Yeah, and it's still reasonable distance. So wouldn't it be Barnet School that would take that lead for the CME for that child? So
you're right, there are absolutely many circumstances where a child may live in one local authority area and be at school in another. Are working together to improve school attendance guidance, and the Children Missing Education guidance does set out that in those cases it would still be the home local authority, so where the child resides, that would be responsible for children missing education duties should that child come off roll.
Oh, okay, if they come off roll, but initially it has to be the local authority where the school is to make those reasonable inquiries, correct?
Well, so it would still be the local authority that the child is residing in, but there are roles and responsibilities and expectations of the school to be working jointly with you to do that. And that, as part of your inquiries, that may involve including the local authority that school is within.
Sorry, I'm still a bit confused, because my understanding is if a school is in another local authority but they reside in your local authority, it's up to the school to be making the referrals and doing the reasonable inquiries firstly. And then what we do, we request that school to make a referral to their CME team within their borough, who would then liaise with us. And then we would do the address checks and everything. But if we find the families are still in that address and they haven't moved, then that would be the responsibility of the local authority where the school is.
So if the family hasn't moved and they're living in your local authority, it would be your CME team that is responsible because they're living in your area but no longer attending that school.
But the child's still on roll.
But they wouldn't be a child missing education at that point, so they'd be expected to engage both you and the other local authority.
Okay, all right, but if it's reasonable distance, yeah, and their school refusing, that local authority, that school cannot remove the child from their role because they would have to follow the attendance route.
Yeah, so of course this only applies when one of the grounds for deletion is met.
Lovely. All right, thank you.
Yeah. Brilliant question. We'll collate the answers to these and put them in writing as well. So please do come back with any follow-up questions. Tracy, I'm going to bring you in really quickly. We are at time. And we can continue these conversations over email also, but please do come in.
Mine's a very quick question, and I mentioned it to you previously, where the challenges we have when children are offered places outside of the home local authority, especially at transition phases, and to get a start date is proving almost impossible. So would there be sort of a commitment from the department to maybe make that information sharing, just a start date, mandatory for all parties involved?
We can take that sort of concern and question away and look at that and work across the admissions team as well. I think that potentially comes to some of the other stuff we talk about in terms of what best practice would be helpful and where there's good local authority join up and information sharing established, how those practices can be adopted more widely as well. But thank you for raising that, Tracy. We will take that away. I am going to wrap us up now. It's been a really great and valuable hour with you all. I'm conscious there's a few questions for HMRC which have come in on the chat as well. So we will take those away and we will circulate those along with all of the other questions and the answers following this session. For those who are concerned that they have not heard from HMRC yet on information sharing agreements, it is a staggered approach that's being taken just to allow for HMRC capacity, but we do have their commitment that they will be reaching out to all local authorities. So if you haven't heard from them just yet, we appreciate your patience. They will be reaching out to you. They're just, as we say, doing it in that 20 local authority intervals. I'm going to hand back to Faye to wrap us up, but please do keep the questions coming in the chat and over email because we can still answer them following this session.
Yeah, thank you so much for today, and apologies that we've run over slightly. As we've been saying, we will answer any unanswered questions, and we will sum up the questions and answers covered in both the chat and out loud as well, and we will send that across to you in a document along with all of the training slides. Tracy's training slides as well, which is offered to share, and as the link to this recording today, so you can always go back and watch that as well. So thank you so much for your time.